excited fams, you're welcome to today's video, and in this video I'll be sharing with you guys tips on how to avoid miscarriage. Okay, I've had miscarriages. It's such a horrible experience. I don't wish it for anyone. By the way, if you have not seen my video on what you have to do, what you can do to conceive, please, I'll put the link up. Kindly check out that video and it will be a blessing to you. Okay, quick disclaimer, I'm not a doctor, I'm not a gynecologist, I'm just telling you guys what I did that worked for me. Okay, so do well to consult your doctor before you engage in any of this. All right, so let's quickly dive into the video. Yeah, the first thing I would like to say is, please, if you are still in your early time of pregnancy, between the first month and the third month, I would advise that you do away with sexual activity. You abstain from sex with your partner for at least the space of 3 months. There have been so many arguments around this. Some advocate for this, some do not. But if I were you, I wouldn't want to take chances, especially if you have had this experience before. If you've had miscarriage before, I would strongly suggest that you do away with sex for at least 3 months to enable the placenta to form. Once the placenta is formed, the risk of you losing the baby is very slim. Okay, then the second tip is for you to avoid exercise or any activity that will strain. This is a no-brainer for me, even though some people still feel like, oh, I've known someone that was pregnant and was engaging in activities and nothing happened. I would like to say that bodies are different, right? Our bodies are really, really very different. So if you don't want to take chances, I will advise that you do away with exercises, strenuous ones, going to the gym, whatsoever. If you can even be on a bed rest, nice, especially if you have had this experience before. Just play cool. No lifting. That includes lifting things. No lifting, no pounding. You want to pound cocoyam, you want to pound this. No, please. At the moment, at least until it's after 3 months. The third thing I want to say is you have to make sure you're not always being around fire, like you're cooking gas, always cooking, always standing and cooking. Do away with that, at least like I always say, for the moment. Okay, because I remember the previous miscarriage I had, I noticed that I was involving in all of this and that cost me the mishap. Okay, so do away with fire and do away with long standing. The next tip I have is for you to avoid some certain food, like ginger, like alcohol, like lemon, lime, caffeine, and peppered food that is very peppery. Some people even said ewedu, that ewedu causes miscarriage. Ewedu causes miscarriage. It makes you, it's for people that want to give birth, that takes it. So this food I've mentioned, there could be many more, but please avoid them. Lime, lemon, ginger, caffeine, even alcohol, do away with them if you're pregnant. Okay, again, you might want to say, I know someone that took it and nothing happened. You are not someone. Please, I don't want to have this experience. Okay, then the next tip I have for you to avoid this horrible experience of miscarriage is for you to avoid taking drugs, medications at your own prescription. Okay, maybe you have malaria. I feel like, okay, let me just pick up malaria drugs. All those drugs can have adverse effects on your baby, that even if you don't have miscarriage, you might end up giving birth to a deformed baby. Okay, so do well not to administer medications to yourself, even if it's Panadol Extra. Do you know Panadol Extra can even cause you harm as a pregnant person, especially at the early stage? So always consult your doctor before you take any medication. It's equally important for you that does not want to experience miscarriage. You're probably pregnant right now, to avoid anxiety, any atmosphere that is not conducive for you and your baby. Please do away with it. And you can do well to probably start listening to music that you like, engage in, see movies, anything that will make you, that cause you to be happy. Happiness hormone does very well to the fetus. Happiness hormone does very well to the baby in your womb. But when you are anxious, you're angry, you're tensed, please, it affects the baby adversely and it can cause miscarriage. Okay, so intentionally create atmosphere that causes you to be happy and joyful and relax with your baby. If you like yoga, you can equally engage in yoga while you enjoy the time of your pregnancy. Okay, and lastly, I would like to tell you to, as a bonus tip, for you to ask your doctor if you can be on progesterone. Okay, because this has been the mishap of many women. Probably you took it before you conceived. You need to be on it, especially if you've had miscarriages before. Okay, you need to be on progesterone. And what settles this is when you go for hormonal profiling, your doctor checks to know if you need it. Okay, and if you have had miscarriage before, ask your doctor, please, is it safe or is it harmful for me to be on progesterone? If he says no, please start taking it. I don't like stories that touch. Okay, so do well to ask your doctor and find out if you can be on progesterone, either the tablet or the injection. It will help you to carry the baby to full term. In my last pregnancy, I was on progesterone up till 50 months. Even when the doctor was telling me, please, you can stop at 3 months, I said no. I want to continue, and today I have my results. Okay, so please, when I started to research about this, I saw that many women don't really care about this progesterone issue, and some doctors actually also, maybe they don't know about it, or they feel like it doesn't matter. Please do well to do proper consultation. That is why it's good to always visit a gynecologist and not just an ordinary doctor. Okay, so these few tips I've given you, if you are able to do it, I'm sure that you will sustain your pregnancy and you will have your baby at full term. So if you have not subscribed to this channel by this time, I don't know what you're waiting for. We talk about motherhood, family life, faith, manners, even relationship. Okay, so please do well to subscribe, and I will see you in my next video. Thank you for listening. Bye.